Hello everyone. I hope you're all doing well and welcome you all to this fever marathon with Dr. Jitesh Sharma. Let's send an invitation to him and then we'll chat. Watch it. Hi, hi Sohan, and Dr. Jitesh Sharma is with us. So this fever marathon was cancelled last time. Hello.
Hello, my voice is clear?
Yes, yes, absolutely. मेरा आ रहा है ठीक से
Uh,
आवाज आपको?
हाँ हाँ हाँ, मेरा वॉइस क्लियर है?
हाँ हाँ, वो थोड़ा सा मतलब शायद नेटवर्क की वजह से प्लस माइनस हो रहा है, बट बाकी वॉइस तो ठीक है।
नाउ
या वो थोड़ा सा ना इसका प्रॉब्लम हो रहा है।
लैग है।
लैग आ रहा है। अब ठीक हुआ, अब ठीक हुआ।
ओके, मे बी नेटवर्क।
वो नेटवर्क को धीरे धीरे इस्टेब्लिश हो जाएगा ठीक से। सो हेलो डॉक्टर
ओके,
जितेश शर्मा भाई, कैसे हो आप? लॉन्ग टाइम।
हेलो हेलो।
हमका
यस,
लास्ट
आई
टाइम
एम गुड।
लास्ट टाइम हमारा पोस्टपोन हो गया। वही मैं जस्ट सबको बोल रहा था कि अभी हम लोग का जनवरी में एक हुआ, फरवरी में एक हुआ, मार्च में बिल्कुल नहीं हुआ, और अप्रैल से अभी नाउ वी आर ट्राइंग टू गेट मोर एंड मोर रेगुलर। देर इज जूनियर मैराथन स्टार्टिंग, जो उनका अलग से एक ग्रुप बना दिया है, उनको अलग से एक बुक्स का थोड़ा सा सजेशंस दिए हैं। तो वो जूनियर मैराथन बहुत ज्यादा रेगुलर हो जाएगा। द वेरी रीजन वाई वी वर गेटिंग डिलेड विद दिस मैराथन सीरीज इज के अभी जो सीनियर स्पीकर्स को बुलाते हैं उनको टाइम नहीं होता है। अभी आज ही एक बड़े स्पीकर हैं जो अभी थोड़े टाइम बाद अनाउंस करेंगे, एक बड़े स्पीकर हैं जिनके लिए हमको कंफर्मेशन मिला है। सो इस तरह काफी टाइम लग जाता है, बट देन इन बिटवीन टू फिल द गैप्स आई थिंक दिस इज द बेस्ट थिंग कि जूनियर मैराथन, ताकि सबको अच्छे अच्छे बुक्स पढ़ने का मौका मिले, सबको अच्छा अच्छा बुक्स के साथ एक्सपोजर हो जाए। सो दिस इज द रीजन वाई वी आर स्टार्टिंग जूनियर मैराथन। एंड कॉन्ग्रेचुलेशन जितेश भाई, आपका पेपर एक्सेप्ट हो गया वर्ल्ड
थैंक
होम्योपैथी
यू,
डे के
थैंक यू,
लिए।
थैंक यू, थैंक यू, थैंक यू। इवन वी आर गोइंग टू मीट एज वेल।
यस यस, वो तो मिलेंगे। बट आपका पेपर एक्सेप्ट हुआ है, इसलिए मेनी मेनी कॉन्ग्रेचुलेशन।
थैंक यू, थैंक यू। Like it's all due to luck because generally they don't entertain outside people. खाली
हम्म।
सीसीआरएच वालों को ही they take it more, तो
मतलब आपका
totally
पेपर
luck।
जेन्युइनली इस बार काफी इम्प्रेसिंग होगा।
नहीं, it's just a case study.
ओके।
Hope.
यस। सो लेट्स स्टार्ट ब्रदर। फीवर फीवर के लिए आई हैव नोन यू हैव टेकन लॉट ऑफ लेक्चर्स। सो सो लेट्स स्टार्ट विद हाउ डू यू अप्रोच, और हाउ शुड अ जूनियर अप्रोच विद केसेस ऑफ फीवर। फीवर के केसेस में क्या अप्रोच रखा जाए?
Probably we need to understand what is to be treated in the fever. अब होता क्या है when the especially we'll start with pediatrics because
हम्म
this is pediatrics is like bread and butter ना because
हम्म।
child लेके आते हैं और बोलते हैं कि अरे he has a
बुखार है,
fever।
ही हैज अ
हाँ
फीवर।
बुखार है, क्या करेंगे क्या करेंगे।
हम्म
And what happens when we take up the case? So
हम्म
we must find the exciting cause. अब suppose, for example, I'll tell the
हम्म
recent case कि वो बच्चा आया and he had consumed cold drink. Like
हम्म।
current scenario, what is going on?
हाँ हाँ।
We'll speak current what is going on here.
यस यस यस।
So in a scorching summer,
हाँ।
he has taken some cold drinks. Okay.
कोल्ड ड्रिंक्स।
After cold drinks, now he's complaining of starting with the throat pain, and now he having a fever of around 101.
हम्म
And we generally don't intervene until and unless fever is above like 101.
हम्म
9900 fevers, it should resolve by itself. So we don't interfere at all because
हम्म।
fever is just an inflammatory sign response.
यस।
So we should not subside until and
हम्म
unless it's 102, 103. So above 101, we should intervene by our medicine.
हाँ।
So we took up the symptoms and देखे कि thirst मतलब very nil, very less, dryness in the mouth and very restless.
हम्म।
And the exciting cause here is he has
कोल्ड
taken
कोल्ड वाटर।
cold drinks in, yeah, he desired cold water,
हम्म
but he got fever. Now, if you read in Arsenic album,
Hmm.
from a good source of Matra Medica. I really
Hmm.
don't know which way where the line has been written there. They desire cold drinks which disagrees.
Hmm. Hmm.
So instead of that, they like warm drinks more. So they have a desire, very strong desire for cold drinks, but their body don't
Allow.
agree to it. Yeah,
Agree.
they fell sick immediately.
Hmm.
So
Hmm.
there comes to the rescue Arsenic album.
Hmm. Hmm.
So that's why this is the way we should learn Matra Medica and we should utilize like this. And we gave arsenic and instantly the fever brought it down.
Hmm.
Next case, very when we speak about in pediatrics, like the child comes very very burning heat because what happens, the parents are very much in the panic mode, है ना? And parents are like, doctor, what will happen when we got cured? We really don't want to give paracetamol, we want your medicine
Hmm.
to be acting. Now
Hmm.
that becomes challenging, that we have to immediately bring down the fever, and that's a
Hmm.
more challenging for a homeopath,
Hmm.
because all of a sudden you don't expect it will be a magic, it's a
हाँ.
process. And we have to see if there is an underlying severe infection. We cannot expect any magic.
Hmm.
We need to understand
Hmm.
कि it's an infectious fever or non-infectious fever.
Hmm.
So for that, again, we need to take a good history. And
Yeah.
history, then examining the parts. Examining the parts are
Hmm.
very, very essential in homeopathy. I'll tell you why. Because you can pick out good rubrics from BBCR. In
Hmm.
BBCR, wonderfully it's written partial heat, partial upper limbs heat, lower limbs heat, partial cold, partial heat. So each and every in the fever chapter in BBCR beautifully. I believe in fever, BBCR is gem boss.
Gem, gem. True, true, true. And
What's your
I
opinion?
and like you rightly said, I was going to add to the same that examining, like if you're now that we are talking about pediatric age group, I think examining the patient is the key to this whole thing. मैं बोला क्योंकि बच्चा तो बताने वाला है नहीं कि उसको क्या हुआ है. तुम मतलब टचिंग बेसिकली व्हेन इवन व्हेन आई एम लाइक अभी अभी टेली कंसल्टेशन का और ऑनलाइन पेशेंट्स का वगैरह का ट्रेंड बहुत चल गया है. सो जो साथ में भी होते हैं ना तो उनको बोलता हूँ टॉप टू बॉटम मेरे को हर पार्ट टच करके बताओ व्हाट फील्स हॉट व्हाट फील्स कोल्ड एंड टंग
Yes.
टंग टंग का बताओ. बिकॉज इट इज वेरी वेरी इंपॉर्टेंट. ये बहुत गेम चेंजिंग हो जाता है कि बहुत बार हम लोग को लगता है कि यार ये कहाँ, ये ऐसा कहाँ मिलने वाला है. सी इफ इट इज इफ इन अ वेरी हाई ग्रेड फीवर, इफ यू गेट टू सी दैट द पेशेंट के फोर आर्म्स पे कोल्डनेस है, तो पर्सपिरेशन फोर आर्म्स लिखा हुआ है अर्निका के अंदर, तो मे बी पर्सपिरेशन नहीं मिलेगा लेकिन कोल्डनेस मिलता है, तो उसमें अर्निका देना चाहिए. एंड डेफिनेटली अर्निका लॉट ऑफ टाइम्स इन सच केसेस हैज हेल्प्ड अ लॉट. So maybe what you're saying is कि examination, maybe you touch the head, मतलब head, feet, chest, back, आगे पीछे सब जगह touch करो, hotness, heat, cold, and then remedies like sulfur, remedies like aconite, ये सब हम लोग को लगता है अरे सल्फर से कहाँ फीवर, एंड जाता है एंड इट एक्ट्स फास्ट. मतलब वो पैरासिटामोल से अभी पेशेंट को तो ऐसे भी हुआ है कि दे आस्क यार क्या पैरासिटामोल दे रहे हो क्या, ऐसा कैसे हो गया. सो दिस इज व्हाट आई वुड लाइक टू ऐड कि यार इफ यू द एग्जामिनेशन इज लाइक द की टू द पीडियाट्रिक में, तो वही है की.
Coming to the Arnika point, when you
हम्म.
said, like, in my life,
हम्म.
I have never ever given Arnika in a fever until one day I
हम्म.
got in case जिसमें
हम्म.
I was not getting any point
हम्म.
apart from this head hot cold limbs,
हम्म.
head hot cold limbs, and very 3 days or 4 days back he had a one just very small injury. मतलब, it is negligible to consider,
हम्म.
but if I connect the dot, I was not getting anything apart from
हाँ
this,
हाँ
because
हाँ.
when we take up the history, and
हम्म.
believe me, that 6-year-old boy, I gave arnica, instantly the fever went down, and
इंस्टेंट.
that day, so I realized, okay, arnica could be given in the fever. So that was quite means very different for me as well. Because see, we are practitioners. We also learn a lot when
या.
we do this kind of thing. So arnica was a beautiful experience when I saw that head hot and cold limb in the fever case. Because arnica, nobody will think as a fever perspective.
हाँ हाँ
Because
हाँ.
it's very different. Nobody will
हम्म.
link up in a fever case. But yes, I have seen because of shocks,
हम्म.
because of shock, then fever. So generally, what comes, we think of aconite, but aconite
हम्म.
has a dry burning heat. And
हम्म.
now to differentiate arnica, arnica head hot part should be cold
आचु.
or lower limbs will be cold. So very easy differentiation when you see the cause is shock. Now after that you differentiate aconite, give me aconite or arnica or even gelsemium. Even if
Hmm.
you think of gelsemium, what happens? Gelsemium, the patient always, when you ask them that what do you really feel to do now, then he'll say that I want to lie down. He's
Hmm. Hmm.
thirstless. He doesn't have any energy to think. Now, then you think of gelsemium. Now, in coming to the gelsemium, especially in influenzaal fevers,
Hmm. Hmm.
generally you see in influenzaal fevers, there are two remedies which is very, very marked for influenzaal fever, that is baptisia and gelsemium. Now, I'll
Gelsemium.
tell you the major difference of both two remedies. In baptisia, there is always sudden onset when the fever
Hmm.
rises suddenly very high, and
Spikes very suddenly.
gelsemium is very
Insidious
slow
only.
onset.
And
Yes,
very,
yes,
very, very, very important you said. I think there is a very fine differentiation. Like now you picked up three remedies by now. You said about arnica, upper part of the body is hot, lower part is cold. Upper part is hot, lower cold में exactly clean tongue के साथ इपिकैक भी मैच हो ही जाता है.
correct,
लोअर पार्ट में
correct.
इफ यू रीड द चैप्टर इन टीएफ एलन का जो फीवर वाला थेरेपेटिक बुक है ना, वंडरफुली इट इज मेंशन एंड आई हैव
HC Allen,
एच सॉरी
HC
सॉरी
Allen.
सॉरी एच सी एलन में वंडरफुली इट इज मेंशन एंड आई हैव एक्सपीरियंस दिस. लोअर लिम कोल्ड था, अपर अपर पार्ट ऑफ द बॉडी में हीट था, क्लीन टंग था. अभी लाइक यू
Clean.
रियली सेड कि इट्स सच अ ग्रैंड जनरल. क्लीन टंग इतना ग्रैंड जनरल है, आप निमोनिया में दे दो, एक निमोनिया का फीवर निकल गया था.
Abhishek, we need to speak in English actually. There are a lot of Turkey people also watching.
Okay, okay. Sorry, sorry, sorry.
Yes.
So I think it is such a big grand general. So clean tongue, upper part of the body is hot, lower part of the body is cold, even epigac. And what you rightly said about gelsemium, I'll just add one point to that. Trembling tongue
Correct.
comes always, always. It is such a important symptom. Come what may be the situation. If you are giving for a depression case, if you're giving for a case of fever, it is such a big grand general, it will come. I think in all my cases of fever where I have given gelsemium, I found that trembling tongue, I just ask him to show tongue, trembling hai, gelsemium. 3 doses, 4 doses, it gets better.
When we find cases where we get stuck with the fevers, and typically we have ferrum phos plus belladonna plus gelsemium kind of
Kind of
picture,
a hmm.
then ferrum phos comes to the rescue.
Ha, ferrum
dull,
phos hai.
dull, and plethoric, and inflammatory signs. Because more of the we have a habit to abuse Econet in all type of fevers, but that is very
Yes,
wrong because Econet doesn't work well
doesn't
in
do it.
it doesn't work. When we speak about the real clinical practice,
Ha
what is
ha.
not on the books,
We'll
when we
not talk
work,
about books. Yeah.
yeah, we have talk about practical utility of our
Ha.
Metra Medica and what actually works. We talk because there will be a right message to go to all
Ha.
the young homeopaths
Young,
or
yeah.
practitioners that
Ha.
what to do in the fever.
Hmm.
Because first you don't panic that what we gonna do, and
Hmm. Hmm.
first you learn to observe and find the
Hmm.
cause what actually had happened. Then he got fever.
Hmm.
Generally, we find like cough before fever or cough fever after. If you find
Hmm.
this rubric, you'll find this
Yeah.
Sambucus nigra. But always connect the remedy with the patient's symptoms. If it doesn't have that kind of symptoms, Sambucus won't help you.
Hmm.
Maybe you are neglecting some more common remedy until unless you reach to the rare remedy or less common remedy, which is not given in fevers. Like for example. Like you said, gelsemium. We have one remedy which is a typical like gelsemium fever, and I believe if I'm not wrong, this desmodium, I guess, has a
Which will.
gelsemium like desmodium,
Ha ha
desmodium
ha.
gangetic,
Yes.
has
Yes.
a gelsemium like weakness, this gelsemium like weakness and dullness, and eupatorium perf like breaking pain in the body. I
Hmm.
think
Hmm.
that
Hmm.
that's the
Hmm.
thing. This is a combo of desmodium gangeticum.
Desmodium. Desmodium.
Yeah, the
And just
Desmodium.
adding to the ferrum phos thing, I recently, like I'm telling you, in like fast last 15 days, I've experienced that whenever there is this whole upper respiratory tract infection, and that we all know ferrum phos is primary inflammation, this and that. But the pain part of the ear is so characteristic. I have recently confirmed in my practice that the pain, if you read Borig's Mathematical pain, it is written that when belladonna fails, we usually feel that belladonna, chamomilla, they are all the primary remedies for ear pain or otitis media. And
Oh,
in
Ferrum Phos is king of otitis media.
king of
That's what I want to
otitis
tell you.
media.
It
So
is very,
when
yes.
belladonna fails, it
Fel-
prevents further suppuration. So
Yes,
it's such a, and
yes,
recently last 15 days I could confirm in 3 4 patients, and I was like, wow, seriously, like we all felt that primary, but this is much beyond primary and
yes.
primary
Even
inflammation.
it raises the like eosinophilic index or what do you call
Yes,
that?
yes.
It was a line that was a line written in I forgot the exact line. It raises the resistance to. Can you make that line? In Ferrum Phos, it raises the resistance to. I don't know my memory.
Mm, I have boric in my hand.
Opsonic index. Opsonic index.
Okay, okay,
Yes, opsonic index. It raises the resistance to fight against opsonic index.
okay,
Yes.
okay.
And
Yeah,
Ferrum Phos
so
is the
yeah,
remedy.
so ferrum phos is such a remedy.
Yes.
So this was about pediatric. Can you tell me more about like how then you progress towards adult cases, because then you have a lot of symptoms, and then maybe anything about toxic fevers, toxic or septic fevers.
Septic fevers, I think everyone knows to start with a remedy that is pyrogenum to comes to the always
Hmm.
rescue. Like if
Hmm.
you don't get results with 200, kindly shift with 1 MEC unless
Hmm.
because most of the very highly septic fevers don't respond in 200. So maybe
Hmm.
1 M. So we really don't know because see what I have seen, Dr. Abhishek, what happens the pharmaceutical, the manufacturing of the medicine, this all matters, boss. This all
Hmm.
matters. I don't know why, but it matters because our experiences with certain pharmacy has been built up because all these years 12 to 13 years of practice we have developed that particular pharmacy and we are not jumping anywhere,
Hmm.
so we
Hmm.
develop that particular efficacy on that reliability on that particular pharmacy or that particular medicine made in that pharmacy. But when we comes to advise some patient and he buys some other pharmacy, then we be in a very dicey part that
Hmm.
why that medicine is not working. Maybe
Hmm.
the pharmacy is wrong, or maybe the potency selection has been wrong. So lot of things, lot of factors I have seen. It really, really depends, boss. I don't know why, but this is a fact
Hmm.
here. And I feel the youngcomers also might have felt so because I personally have feel because I have seen certain pharmacies action in the I have played with them. I have
Hmm.
taken the remedy of this pharmacy and this pharmacy and I have checked this pharmacy didn't help and that pharmacy remedy helped.
Hmm.
So that that actually I have seen it makes a major impact when selecting a right remedy. So
Hmm. Hmm.
what
Hmm.
remedy pharmacy you're giving? Like I told you in septic fever, like many of the cases 200 doesn't respond and 1 M response.
Hmm.
So and even in toxic fevers you find like arsenic is also one of the beautiful remedy.
Hmm.
You
Hmm. Hmm.
wanted to say, huh? Please add, please add.
No, no, I was just saying for toxic fevers, I think a lot of times when we get too much involved, like if for toxic fevers, we have a lot of important remedies, but now it again depends like what kind of toxic fever, what kind of septic fever, where is the septic foci. So we need to, when we are dealing with such cases where there is persistence 103, 104, 105. Chalo, in pediatric age, let's not talk about the pediatric age group, but for adults, I think a lot of times patient is ready to wait and he says, sir, medicine is helping. So, what I had heard in Calcutta, what I'm just sharing Calcutta, a few tips from Calcutta, China, ours and China self. Simply, they used to say that if you don't understand, if you have no brain, and if you have absolutely no confidence in treating fevers, you should know just two things: China self,
Okay.
China ours. So
Okay, very nice.
if your patient is hot, give China
China self.
ours. No, if your patient is hot, China ours. If your patient is
Okay.
self, then China self. And that too in 6x potencies. They used to say 6x potencies. Now, this reference comes from malarial fevers. The
Okay.
reference comes from malarial fevers, where the malarial fevers were not settling, and Calcutta being a marshy land, there is a lot of
Malarial fevers
malaria.
and
Malarial
everything.
fevers are quite prominent there. So this is where the classical old prescribers of Calcutta have mentioned there. and this is what our teacher, Dr. Faruk Master sir, had taught us, that when sulf goes with a combination, like Hepar sulf is a chili remedy, sulfur is a hot remedy. Similarly, when
Okay.
it comes in chininum sulf, it becomes again a chili remedy. So, this is about toxic fevers. I'll talk something more, but you please continue.
So I would like to just add in this, like you
Hmm.
said, Marcy Land. So I have seen like where the patient is living in which environment, like all everything depends where he's staying,
Hmm.
where he was, and what exposure did he went through. Then you give the remedy. Suppose he get wet, है ना?
Hmm.
He got wet
Hmm. Hmm.
and he
Ah,
came. Like currently in the rainy weather, he got wet
yes.
and he coming to you and asking for a cold water.
Ha.
Doctor, do you have a cold chill water I want to drink? He's full wet and he's asking for a cold
Cold water.
drink. Okay. And you know this typical picture is of Dalkamara.
Dalkamara.
Dalkamara it has been written burning thirst for cold drink. It has more thirst for cold drinks more than phosphorus.
Hmm.
I learned through this Fata clinical experiences about this Dalkamara. And coming back to add chinium sulf, I would like to say in my career when I used first, I read about that chills, the typical
Hmm.
chills which mentioned in chinium sulf where it start from the back.
Hmm.
So whenever I get a case where patients tell you that I have lot of chills at the back,
Hmm.
taking three to four blankets
Hmm.
and literally shivering like anything after taking 3 to 4 blankets, still shivering
Hmm.
and chills starting at the back. It's
Hmm.
very feeling very cold at the back, especially on the coccyx, the spine region. Chininum sulf has never ever betrayed me.
Hmm.
2 to 3 doses, and that patient will get up and he start doing his work. That
Hmm.
magic, that power I have seen. That's my experience I wanted to share about Chininum sulf. I didn't know
Hmm.
about this Calcutta thing, but my experience of Chininum sulf is this.
No, Calcutta
Severely, if
people
you
are
get
very,
chills,
yeah, Calcutta people are very fond of Chininum sulf and Chininum
using.
ars in using in fevers. I think this
Okay.
is what I have been taught by my teacher. But if I had to just highlight something, Dr. Pooja Patel, which remedy? बोल तो रहे हैं Chininum sulf,
Chininum
Chininum
sulf.
ars.
Acha,
Okay.
regarding chills, I want to add, Abhishek,
Yeah,
this,
yeah.
one of the most chilliest remedy where like the patient will sit in front of fire also, still he will
Hmm.
tell, I'll feel cold.
Hmm.
That one remedy is especially useful in this rainy weather, especially. We call it
Hmm.
Arenia diadema.
Arania diadem.
Yes. Like chills which penetrate through the bones.
Bones. Bones. True.
So much of chills. And Arenia,
Hmm.
we all know for the heel pains we generally give when it walking ameliorates in the
Ha
heel
ha
pain.
ha ha.
Even in the plantar fasciitis
Plantar
also, we can
fasciitis
think,
we use. Plantar
yes, we can
fasciitis
think
also we
of,
use.
yeah, we can think of Arenia. Yeah,
Arania
sorry,
diadem.
continue.
No,
Yeah.
no, I was just saying that toxic fevers, I think there are few mother tinctures also which we like I have used when I used to get stuck up. So that also have you used any mother tinctures for fevers like
Never, boss. I have read it all, but I never use mother tincture in fevers because I feel that is very because that's
risky?
my opinion.
Ha ha
Maybe
ha.
I don't know. Maybe I don't know. He get diarrhea. He may get diarrhea. He may get whatever. I don't know. But that's the reason I've never used. Instead of that, if
Hmm.
I find like especially like bilious fever,
Hmm.
right? Bilious fever, we think of belladonna and everything. But there is a one beautiful remedy which has been used and abused in
Hmm.
mother tincture in sciatica cases. I have used in 30 potency, that is Nyctanthus.
Nick Nanthus. Nick Nanthus
Nyctanthus
is
has lot of, yeah, fever. It's a
yeah.
very wonderful bilious fever remedy.
Yeah,
Lot of
bilious fever.
lot of nausea in the fever, and you find this Nyctanthus is a wonderful remedy. But I have seen Nyctanthus role in sciatica is also very strong. It has been abused as mother tincture a lot, but just an advice you can use in sciatica at 30 potency also.
This is what I've learned today because I've used Nicthanthus, but I think I'll be in the list of abusers because I've used plenty of times in patients where there is liver failure and constipation.
Yes,
And
Nyctanthus also helps in that. Yes.
so liver failure, constipation, and most importantly, when the patient is very abusive, because the common name of the Nicthanthus is Pagla Mali.
Yes.
So that is what the we have taken as doctrine of signature, and the provings itself that and there is just one line written that patient is very abusive. I think it's stuck up. Yeah, thoda
Wait,
sa.
one
Yeah, there
second.
was a. Yeah, no problem. There was a buffer.
I was getting a call. One
No,
second.
no, no, no problem. No. We'll wait. Nyctanthus.
Yes, sorry.
Shri Amar, we are talking about Nyctanthus arborescens. नहीं तब तक वो there was a question from a student, so I was answering the question.
So there is another question, na? This, what is bilious fever? Can you explain?
Bilious fever is usually, हाँ, please, Jitesh bhai.
Hello.
Yeah, there is, I can hear you by bilious fever. They are
Yes.
asking about bilious fever.
Generally, all the liver involvement
Yeah,
plus gastric derangements, that kind of fevers are called bilious fevers. Like we said, Nicknantz
भाई थोड़ा lag आ रहा है,
to be
थोड़ा lag
mentioned.
आ
Then
रहा है.
that remedy, like, yeah, hello.
Yeah, there was a little bit of a lag.
अभी ठीक है?
Hmm, थोड़ा सा है. Maybe it will take some 30 seconds to settle down.
Yeah, now I think that would have
Now it is gone. So,
recovered.
so
Yes.
yes, you were saying,
Yes.
you rightly mentioned, whenever it is written bilious fever, it's more about to do with your liver and gallbladder. So when you have a SGPT, SGOT, GGT derangement, when you have a digestive disturbances, when you have any kind of hepatitis with the fever, so these kind of all the fevers, you will take it as bilious fevers. When you have all the mild disturbances along with the fever. So this, I think, should answer the question for people who have asked bilious fever. So in bilious fever, as Dr. Jitesh sir is answering, that Nyctanthus is a very good remedy. Nyctanthus is also a good remedy for sciatica. Yes, Jitesh bhai. Yes, Muskan Fatima, Muskan Fatima here. Your answer is done. Okay, so bilious fever, and also we were discussing that it's a very good remedy where there is liver failure, and a concomitant for that is constipation. By mute निकाल दो. I think you've not removed your mute.
Yeah.
Yeah.
Now it's fine, I
Yes.
guess.
Now it's fine. Yeah. Please continue with fevers.
Yes. So we were speaking about. I'm sorry, I lost
Nyctanthus.
the
We
track.
we spoke we spoke about Nyctanthus.
Yeah,
We were to continue from there.
bilious fevers.
It's okay.
I'm
It's okay.
sorry,
It's
my
okay.
kid.
No, please, यार. It's okay. Now we all understand. इसमें क्या है?
Uh, so to continue about the bilious fevers, there is also the chelidonium, brainia.
हाँ,
These all
चलिए.
the liver more hepatic action remedies are wonderful in this, but definitely you need to match with all symptoms. Like
Yes.
chelidonium will have hot desire and everything, hot
Hmm.
drinks, and
Hmm.
even brainia has a desire for cold drinks,
Hmm.
and phosphorus
Hmm.
also has a very strong action in that they will get nausea and a
Hmm.
lot of vomiting
Hmm.
along with this.
Yes.
So in these type of cases, you can think of definitely. See, it's not about going off pathological, basically connecting with the symptoms of the patient. That's more important here, rather than giving them a tag. What diagnosis you're doing. Definitely, you should have a knowledge of physician is very important what you're treating with, but it's more important to understand the patient's symptoms in order to treat.
Malika Mutaji, it's given in about Nyctanthus. You can read in Boric, it's given. So we'll switch. We'll just take it ahead. About after bilious fevers, no, I think there was some point. Yeah, about septic foci. We were discussing about septic foci. So
Yeah,
you
I would like to
we
just add about this
yeah, please.
aerodynamic fevers.
Yeah,
Aerodynamic
please.
fever.
Yeah, please.
Aerodynamic fever, you know only two remedies, ferrum and gelsemium.
Yes, adynamic fevers.
Adynamic fevers, where there
Okay.
have lot of weakness, lot
Hmm.
of vitality loss, and they cannot. There are lot of debility when
Hmm.
you get,
Hmm.
and every alternate day fever. That's China.
That's China. That's China.
That's China. Periodicity.
Periodicity. So China is again China. Again, your bilious fevers also are covered by China. It can be used in
Yes.
low potencies, high potencies, depending upon its susceptibility, and works wonderfully as a mother tincture also.
Yes.
My favorite topic is mother tinctures, so I'll keep poking in between because I use a lot of mother
No,
tinctures.
you can. No,
Previously,
you can. You can.
previously I used to Cedron. Yes, Yashvardhan. Yes, Cedron is also a very good important remedy, but I think that's more for headaches. What we are discussing is about fevers. But yes,
No,
periodicity,
no,
Cedron
Cedron.
is.
I got him why he mentioned Cedron. Cedron because
Huh,
of the periodicity
yeah,
of complaints. Cedron comes with a top, na.
periodicity. Yeah,
That's the
for
reason.
But for I think periodicity, I think there was one more remedy I'm missing out. One was Syncona, one was Cedron. Again, see the Cedron is more of headache. Yeah, Eupatorium perfolitum mother tincture. Shwet, yes, you're right. Eupatorium perfolitum we use a lot when you are saying with all these adynamic fevers where there's a lot of weakness. Also, Eupatorium perfolitum we use for where there is cough after fever.
Mm-hmm.
For cough after fever, we use it in potency, obviously not in mother tinctures, but we use mother tinctures a lot while we are treating, and there is profound weakness, body ache, malaise, joint pains, this, that, all these things have started. While there is one part of while your dilution is taking care of your fever, if you want to support yourself with the weakness simultaneously, uh, I think Eupatorium perfoliatum is one important remedy. But
Okay,
mother
another
tincture,
remedy that is very, very important when we speak about this remedy.
which remedy?
Lot of burning. Ocimum sanctum.
Ossimum sanctum. Hmm.
Ocimum sanctum has lot of burning fever. Very lot of the burning is very prominent here.
Hmm.
The sensation of burning and everything. If you read Ocimum sanctum, you find that like more burning than lachesis.
Hmm.
Oceum sanctum. These all are neglected remedies, but
Hmm.
I think we should have a note about it because we never know what remedy comes to the rescue in the fevers.
True, true.
I have never used, but I have found this antifebrinum a lot. I have read about
Antipyrinum.
it a lot, but antifebrinum.
Antipyrinum.
But believe me, Abhishek, I have never used till now.
Same here, same here.
I really want to have that experience because people have been posting a lot about it, but I have never got opportunity because I didn't find any patient to get treated
Yeah,
with
maybe
antifebrinum.
same here. I have not, maybe I've not perceived that remedy well that I can understand. So I understand that remedy well. I have it, but अभी तक cap open नहीं हुआ
Same,
है.
same here, same here,
Antipyrinum.
boss. I really want to have that experience about antibiotic, what I have learned from many sources, but I don't know when I'll get the opportunity to give antipyrinum.
Okay, so somebody's asked about some Indian drugs for fever. Some Indian drugs for fever, my favorite and on the top, the top, इससे ऊपर कुछ भी नहीं
Yes,
है. Is
please go
Swarshia
ahead.
Chirata. Swarshia Chirata. It is like the king of fever. If I have failed, like I have miserably failed in my case, I have मतलब मेरे patient का my patient's fever is not breaking out. Like I've given this, I'm trying to observe, I've tried to the Swarshia Chirata. I think the most distasteful mother tincture. Even if you
Are you
open,
talking about Calmate?
na,
Acha,
Swarshia
that
Chirata.
is endographic panic
Gentiana
chirata.
Chirata.
Okay.
There are two
Acha,
names.
Gentiana chirata.
Gentiana
Okay, okay.
Chirata, Swarshia
Chirata.
Chirata, Swertia. Swarshia
Okay.
Chirata,
Source
Gentiana
chirata.
Chirata.
Okay.
Wonderful remedy, which it does, it will break fever for you.
For sure. Okay.
For sure, without fail.
Okay.
Like never I have had this case that my all remedies, all my dilutions are failing, and now is the time that I am going to break down. कि यार भाई क्या हो रहा है? मतलब what's wrong? So Gentiana Chirata will give you that phase where the patient's fever will break down, and you can have more number of symptoms.
What I have seen, like when the fever doesn't grip down, you can try baptisia in low potencies.
Baptiste and low potencies I've never tried. I'll
Yeah,
try that.
1x,
I'll try
1x, 2x,
1x
3x.
2x.
1x basically. You can
Mm-hmm.
try in mother tincture if you want to. maybe.
Baptisia mother tincture I use, yes.
Uh,
Baptisia mother tinctures I've used for fevers. So I learned from a patient. There was this
okay.
patient in Banaras, and I
Bhai,
prescribed
only
him.
patients teach us well.
Yeah,
That's the
yeah,
best
yeah.
experience
That's the
ever.
best
Only
teacher.
patient teach you. Yes.
So
They are the best teachers.
I sent him a prescription. Fever has. I took down all the symptoms. I said, Baptisia, I have to give. I wrote him a prescription. I told him to take every 2 hourly, take 4 doses and revert back to me. He didn't get 1 M. He took mother tincture. He was fine.
Acha, regarding this baptisia, I would like to share my niece case.
Yeah.
This my she he had sorry my nephew he
Huh.
had this tonsillitis,
Huh.
painless tonsillitis, and
Huh.
I just saw the picture and gave in baptisia. The painless tonsillitis only baptisia was written, and I was like, okay, let's give baptisia, and he had high fever like 103, 104, and he doesn't have any pain in the throat, and we gave baptisia 30. In Australia, he lives. So I gave Baptisia, and within 24 hours, he was perfectly all right. Even the tonsils went away. I have showed this
Hmm.
case also because that was my experience. Because till now also, I have never used in my life. I have used Baptisia only once in my nephew for the tonsil case, boss.
Hmm.
And after that, I have never used ever for Baptisia in a tonsil case at least.
See, as you rightly
Because I
said,
have never got
patience.
any case, na, painless tonsil. Only I got only one case till now. So that's the
Hmm.
exposure you can say, or you can say that
Hmm.
hard luck. I have not get major cases because lot of the tonsillitis cases, if we treat, ferrum phos is the king, belladonna,
Hmm.
and depend on the symptoms, right
Hmm.
side or left side where they have a radiating pain. When you speak about the patient tell you that I have a tonsillitis which radiates to the right ear, then you think of MIF, Merck
Hmm.
iod
Work
flavors.
out
And when the
flavors.
patient tells you that it radiates to the left side, we think of Merck iod rubor.
Ruber.
Yes. So these few remedies are actually very wonderful in the severe tonsillitis cases. Now we talk about the chronic tonsillitis cases, then
Huh.
that really cures with Brita carb or Calcarea carb, or depends upon the constitution or what is the history of the patient.
Huh.
That's a major part to play. Even Phytolacca.
Huh.
Phytolacca is also wonderful remedy for tonsils where you struggle with the enlarged glands and lot of shooting pains, typical electric shock like pains that reflects the
Always,
Phytolacca.
always.
Yeah, and even this what we call the hot and cold change of climate, and suddenly the throat pain starts. Merxol 200 one dose is more than sufficient to realize that what homeopathy can do. If
Hmm.
somebody
Hmm.
comes on that early stage, then only. Note my point here in
Hmm.
that
Hmm.
particular stage only was. After that, nowhere Merxol exists.
Hmm.
Like I'll tell you why, because one of my friend came in my clinic and he just came to pick me up. We wanted to go somewhere, and he
Hmm.
just came and he told that Jitesh, do you have something like I had some cold and then I took some warm drinks and then I have some sore throat like thing and it's very it's he was continuously hawking.
Hmm.
They're trying to clear his throat, and I was like, okay, wait. I gave Merxol 200 one dose, and he was like within 20, 10 minutes. He was like perfectly well, and he even went out and said other four friends ki bhai Jitesh has done some magic.
Huh.
In one dose only, he has cured me. So when you do positive things, you get positive outcomes. And one
Yes.
one wrong mistake is like, oh, what homeopathy doesn't know anything by homeopathy doesn't work. So we have both the things here. But
Hmm.
to be excellent in this field, you need to learn a lot. You need to have a lot of exposure, and the major part is to see a lot of patients. Then only you can actually learn and grow. So
Hmm.
this is the very strong advice to each and everyone that please, whoever sees more patients, you visit them and
Hmm.
sit with them. And of course, the classical prescribers are very important here to
Hmm.
learn, not polypharmacy.
Hmm.
I really don't endorse that. And you please learn proper classical homeopathy. That's where the importance lies, and your future also dependent on them. Because in polypharmacy, few days you'll be very happy, but after 6 to 7 months, you will be struggling with
Hmm.
that patient's severe complications and peeling the layer and again, and you will be like that. You will lose that patient for sure. He will go to allopathy only. He won't come
Ah.
back to you.
And when you're doing polypharmacy, it's moreover like you are also doing making allopathy out of homeopathy. Okay, so there are some questions, Dr. Jitesh. We'll
You
start.
know, that's the
We'll
problem.
try.
I cannot see any question. That's the
Okay,
problem now.
I'll ask. I'll read it out for you.
Yes.
So there is one question which reads, "Can you throw some light on oscillating fever?" But before that, can you talk something about Nux vomica fever? There's one question before that.
Nux vomica, I have learned very well. I'll tell you two things.
Hmm.
First, in
Hmm.
Nux vomica, whoever patient comes and tell you that doctor, I feel that I have
Ah.
went in a conference and there everybody was coughing and everybody, I don't know, everybody was sneezing. Now I feel
Hmm.
that these symptoms are prevalent. This fever anticipating chill
Anticipating.
thighs. You find only all single remedy in Nux vomica.
Single
So
remedy
this
is Nux
way,
vomica.
yeah, this way is Nux vomica. Now second way I'll tell you. Any chills which is not at all responding, please give Naxwamika 4 to 5 doses. The chills will subside immediately and the patient will feel relaxed. I have found very strong chills in Naxwamika. Of course, you see what he has been traveling somewhere or
Hmm.
he has traveled somewhere where the
Hmm.
people were sick or whatever might be the reason, but you need to see that first. Then you give Naxwamika. Naxwamika definitely helps in this kind of fevers where they
Hmm.
have it starts with excessive chills, with basically rigors. Rigors.
Hmm.
Rigors are more heavy than
Ha.
chills. Chills with rigors, I have seen
True.
Naxomica has been wonderfully acting in this fever cases. But definitely the patient gets thirstless. Uh, and even he feels very irritability. He
Hmm.
doesn't want to talk or don't ask me, don't ask me. Typical like Brania like picture. The difference is Brania has lot of headaches. Naxwamika is also high, but Naxwamika has that kind of anger temperament. Like Naxwamika will actually
It's
curse you.
more of
Brania gets
irritability.
very irritated.
Yeah. Yeah.
Yeah,
It's more of
like
irritability and
Naxwamika may
sleeplessness
curse
that
you,
comes in.
may
Yeah.
abuse you. Brania doesn't abuse you. Brania will tell you, just don't talk to me, stay away.
Hmm. Hmm.
Brania will be like avoiding. He wants to be alone.
Hmm.
Nakswamika doesn't want to be alone. Nakswamika will actually curse you and he will tell you that he will keep on just nagging you. He gets very
Yeah.
much
Yeah.
annoyed.
So see, there are a lot of in pediatric age group. If we had to, if I Dr. Snehal, no, whose question was that? Dr. Surajmukhi. So Dr. Surajmukhi, if I had to answer, no, in pediatric age group, you see there is a lot of times when patients will start kicking. That kicking irritability, that is what I think what Dr. Jitesh was saying in Nux vomica Nux vomica, that kind of irritability, sleeplessness with fever and with, as he rightly said, chills. So that is
Chills.
your answer about Nux vomica.
Nakswamika.
So can you throw some light on oscillating fevers? There's some question from Pacific Homeopathy. Oscillating
Oscillating
fevers,
fevers.
see,
First, we need to understand why it is actually happening. Is
so
there some
oscillating
underlying infection?
Hmm.
Yeah,
So
please
oscillating
tell.
fevers is something which goes in alignment with malarial fevers. There is
Yes.
fixed timing where the fever will keep coming. So definitely get tested for malaria. Then you will have a better answer for this kind of fevers. And if again there are remedies which you will read in the repertory, that there are fevers, periodic fevers coming at the same time of the hour.
That's what
So
Chinium sulf.
Cinnamon
Chinium
salves.
sulf is a
Yes,
wonderful
yes,
remedy in
yes,
oscillating
yes, yes.
fevers. Or
Okay.
China asks with lot of debility,
Yeah,
lot of weakness.
yeah. So there is one question. What do you give when there is no other symptom except heat?
Belladonna. Who can
Belladonna.
ignore that?
Okay. Fever with follicular tonsillitis, sir.
I would think of ferrum first.
Ferrum first. Okay. Acute follicular tonsillitis. Also remember, sir ne ferrum first, sir has
Even
said ferrum first.
alternating tonsillitis where the patient will tell you he had left side then right side. Now the catch
Hmm.
comes to leg caninum.
Lac caninum. And
Yes.
also remember, for because it is follicular, you can also think of staphylococcin.
Yes,
Yes,
staphylococcus. Even
and
streptococcinum, if
streptocockin.
ASO titer is very high,
ASO titer is
then
high.
along with your constitutional remedy, you can actually give a intercurrent remedy as streptococcinum to break that ASO.
Yes, yes. So Dr. Chandresh Dubaria is asking about allergic rhinitis. I would suggest him to go and listen to the lecture where our
But
sir
I would
had
like to
come.
answer this.
Yeah, yeah,
Allergic
please.
rhinitis, you please
Huh.
think of remedy Galphemia glauca.
Galphemia.
Yeah,
Okay.
Galphemia glauca is a killer in allergic rhinitis. But chronic history who has that comes to Kali iode and more of a Kali iode kind of picture where they have chronic. We have deviated DNAs and spurs and everything in allergic rhinitis, then
Hmm.
you think of Kali iodine, those
Hmm.
cases. But to be a very straight and simple answer, Galphemia is a wonderful remedy, and second remedy is Lufa operculata.
Lufa operculata.
Yes, these are
Okay.
very neglected remedies, but they are the gem remedies when you struggle. Even like
Okay.
when you're tired of giving Sabadilla and everything,
Hmm.
you can think of Galphemia. Even Panthorum. Panthorum has a typical symptom, na? It has
Hmm.
continuously nose dripping or kya tha that I forgot. In
Hmm.
Panthorum, there is constant wet nose.
Hmm.
Panthorum is a wonderful remedy
Panthorum.
for the
Panthorum. Panthorum.
Panthorum.
Yes.
Constant feeling of wet nose.
Wet
So,
nose.
wet nose.
Okay.
Constant feeling of wet nose.
Okay.
Panthorum.
And now there is one question. Dr. Snail want a session on skin disease. It has already happened, madam. Go to my page and see. Dr. Sominath Gopalkare had come. Wonderful lecture it is. Or you can go to the YouTube channel also. Please, Dr. Shwet Desai is asking, please share your experience with camphor in fevers. Camphor in fevers, Dr. Jitesh,
I'll share my father's case only
yes.
because in that only we gave camphor. He was completely cold in COVID
Huh.
case.
Huh.
His body was completely cold. He had a
Okay.
fever of 101, but it is actually externally the body is very, very icy cold. And
Hmm.
we gave camphor like 201 dose, and he was completely well after that.
Hmm. Hmm, hmm, hmm. Okay.
So my experience that this
Wonderful.
icy coldness of the body is more important for thinking of camphor.
Hmm.
Unless and until there is no symptom, please don't prescribe like
Camp.
vaguely. Like even in children who are in more of delirious state or he had a history. I'll tell you interesting case
Hmm.
where I got a case of fever after watching a horror movie or horror tale. But what happens, I'll tell you honestly, Abhishek.
Hmm.
It is very hard on a
Hmm.
first consultation to extract this information that the child got scared after watching
Yeah.
movie. It's very difficult. I'll speak about like very honest fact.
Huh.
It's very difficult to get on because so you need to give a time, at least 15 to
Hmm.
20, 25 minutes to think what
Hmm.
has actually went wrong. Then
Hmm.
you dig, keep on asking what happened, and then he told that okay, he was watching something like his sibling, her sister, the
Hmm.
patient's sister told that okay, no, he was watching something. I was watching, and he was little bit terrified, and this and next this ailment from like fright
Hmm.
which remains and then he got fever. The one and only remedy is for that case is opium.
Opium.
Opium will actually cure that fever,
Hmm. 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 Hmm, hmm.
where it is ailments from fright which actually remains in the his mind, which the fright remained in his mind. Now
Okay.
most of the things will be confused about stramonium in this case,
Hmm.
but
Hmm.
stramonium may get
Hmm.
more terrorized and maybe he will have that kind of nature of violency
Hmm.
plus
Hmm.
a terrified person, both the things, the both
Okay.
the nature you can find
Hmm.
in this in stramonium,
Hmm.
and even delirious in fever. When that stramonium fevers will be like 101, 102, sorry, 102 and 103 kind of fever, especially like Veratrum album fevers, very high
Hmm.
grade. And he thinks that he is in delusion with the communication with God or some higher authority all the time.
Hmm.
Like,
Hmm.
and he may loves gambling and this kind of nature of Veratrum. Even
Hmm.
in high fevers, Veratrum has helped a lot. Now in
Hmm.
COVID cases, Veratrum Viridae actually helped a lot
Hmm. Hmm. Hmm.
compared to that. And
Yes.
just now, I think Dr. Bandana has mentioned that Veratrum viridae and Ferrum first. These
Yes.
two remedies actually is the main remedy where it is written that it raises the opsonic to fight against opsonic index. So
Hmm.
the
Hmm.
both helps in pneumonia.
Yeah.
That's what I'm telling. Ferrum
Yeah.
first also helps in pneumonitis and Veratrum
Hmm.
viridae also because Veratrum viridae I got exposure from Borland pneumonias.
Hmm. Borderline
Borland
pneumonia.
has written beautifully in the Veratrum viridae in pneumonia, Borland pneumonia. Because in COVID cases, generally what happened, it was pneumonia, and I would really suggest all the newcomers or youngcomers, please go. There's a PDF available everywhere, Borland pneumonia.
Borderline,
Please go through that.
Borderline pneumonia, we are going to read in junior marathon. Already somebody has chosen
Oh,
that book.
are wonderful,
Yeah.
wonderful,
So
wonderful.
I don't remember. I don't remember who has chosen that book, but Borderline pneumonia and Borderline children types. Somebody has already chosen that
Yes,
book.
yes, Borland children types are also amazing,
Yeah.
and it will be a wonderful marathon. I'm for
Yeah.
sure if you're choosing this kind of book, so it will be a, like blockbuster se bhi upar, like
Yeah.
very wonderful. Like that's a need of the hour.
Yeah, so deliberately we are focusing on such books which need to be highlighted. Okay,
Yes.
so I think there are. Then there is one question which says fever in cancer patients. If I can just answer that, it's very difficult, doctor. That Dr. Rishi is asking that fever in cancer patients. That's the whole tragedy. When you ask a cancer patient when did he last have a fever, they'll say I don't remember. They'll tell you I don't remember taking a paracetamol throughout my life.
And
But if
that's
you're
why he
asking,
developed a cancer. That's
that's
the
why he
reason.
developed a cancer. So bile, okay, let's take that it's a stage 4 cancer, it's a buccal mucosa. So if there is a septic foci somewhere, the patient might have fever, but it's very rare in cancer patients to have fever. Like Dr. Rishi, if you have any cases which you are seeing somewhere around you, please send a DM. We'll get to learn with you. Okay. So I think we have answered all the questions also, opium containment and stramonium panic. Yes, Dr. Atul Mahajan, thank you so much for highlighting.
Dr. Atul is
I think,
gem.
yeah,
Call him
Dr. Atul,
sometime.
he doesn't want to come.
I want to learn.
वो बोल रहे हैं, he's saying you come to my place, only then I'll teach. Only
Only
he
personal,
does
only
he
personal interactions.
only
No way public.
yeah,
I
yeah,
won't be.
no,
I
no
know
public.
I cannot come public.
Yeah, he doesn't want to make public statements. So he said, you come to
Yes,
Dr. Ranjan Da, and he's very close. He's like 1 hour away from Ranjan Da's clinic.
I'll definitely drop
Yeah,
him
so someday,
someday.
whenever we go to Ranjan Da's clinic, we'll go there.
So
Okay, I think it's an hour now, and we have discussed quite a few things about fever.
I
I
think we
think
discussed enough.
yeah, I think we discussed enough. And yes, somebody was asking about mother tinctures. There is a surprise coming very soon. A very big name in the world of homeopathy is soon going to come uh, for fever, for mother tinctures. So, guys, stay tuned. Tell your friends, keep spreading the word. And thank you so much, Jitesh bhai, for always dropping in whenever I wanted you to come. You
Always
never
there.
said a no to me. And I see you soon now, in next week. Let's
Yeah.
meet next week in Gandhinagar. In
Next week
Gandhinagar.
Thursday we meet in Gandhinagar.
We meet in next Thursday, actually, exactly in a week.
Next Thursday
We
we meet in
we
Gandhinagar.
meet in Gandhinagar. Okay, so guys, that was it for about fever. We'll see you again soon with some nice new topic. Bye bye. Take care and have a good night.
Bye. Bye. Thank you. Good night.